Important health headlines for you today, including new information about a possible genetic link with sudden infant death syndrome and hope for a cancer vaccine. Researchers at Stanford University announcing a clinical trial on the heels of successful tests of a vaccine in mice. Dr. Devi Parampil, an associate professor of rehabilitation medicine at NYU School of Medicine, joining us now on the story. This cancer vaccine, I saw the headline and I thought, this can't be right. But the study found that in, I think it was 97% of the mice, the vaccine actually worked to reduce the tumor. We're not talking about any chemo here.
Exactly. So that's what's so revolutionary about this concept. I mean, we still have to see how it goes in human trials, but it's a completely different way of trying to attack cancer. So chemotherapy, the way to think about it for the most part is that it's poison, right? And that you're disguising it as food, and the fastest growing cells, which are cancer cells, are racing to get that food, and then as a result, they beat your normal cells and then they die, right? But with this, it's different because you're using the body's own immune system to try to fight the cancer cells. So your immune system should fight the cancer cells, but somehow it doesn't.
And this is an area where there's been a lot of research and a lot of promise recently in terms of, is it called immunotherapy?
Exactly, that's it. So we looked at, you know, in the past year, in the fall, the FDA approved a different type of immunotherapy called CAR T. This is similar, but it's a little different. So you're actually injecting the tumor, the cancer, with these things that sort of cause the immune system to attack. And as a result, if it recognizes those cancer cells around it, then as they kind of patrol the body, these immune cells, they're sort of like police going around in the body.
Yeah.
If they recognize it in other places, then they can attack it there and defeat it there as well.
It's pretty remarkable. So this is going to be, as you point out, we should be a little cautious here. This is a great headline. Obviously, we need to see what happens with humans in this clinical trial. What types of cancers are they looking at in the trial?
For the trial, they're specifically looking at lymphoma. With the mice, they also looked at breast cancer and colon cancer. So they're trying to look at cancers that seem to avoid the immune system. So they're not immediately apparent. Like, for example, with colon cancer, you know, the reason we do colonoscopies is to try to find the polyps, to try to find these other things, because the immune system doesn't seem to be reacting to them very aggressively, right? So a lot of these new therapies are looking at how can we make them not invisible to the immune system? How can we make it aware?
Science is amazing. I continually say this, so we'll watch for that one. Meantime, there's also been this other new study. So researchers are saying that they noticed in some cases of SIDS, there may be some sort of a genetic link. What did that show?
Well, it's basically the genetic link. The gene is for something that affects the muscles. So our muscles in our body are kind of battery operated, essentially. The electrolytes kind of form that positive and negative charge in our respiratory system and our muscles. So what happens is, you know, if a child doesn't have those respiratory muscles working as effectively, if something else happens, let's say perhaps, you know, something gets, like a swaddle or something else gets in their face, they may not be able to react appropriately. And so as a result, they're more predisposed maybe to SIDS.
So is the thinking that this could ultimately be something that we could test for in advance to know whether a parent may have this gene or even whether the child may?
Yeah, exactly. So then you can actually maybe consider also different medications that might help with those, you know, those signals and those electrolytes, and also make the parents more aware. Because right now, we do have an effective intervention, but we don't know exactly what we're treating. You know, we tell parents, every parent with a newborn, to basically keep their baby on their back.
Keep everything out of the crib, right? No bumpers, no blankets, no stuffed animals.
Exactly. Don't sleep with your baby, you know, and that is effective. So that is something to follow. But if we have more information to know what exactly is going on, then we'll be hopefully more successful at preventing SIDS.
Always good to have that new information. Great to have you here, and congratulations, because this is the first time we're seeing you since you became a mom. So
yes,
congratulations.
I've been reading a lot about SIDS.
On the birth of your daughter. Yes, exactly. Well, good that we're looking at some positive hope when it comes to SIDS. Great to see you. Thank you.
Thank you.